This computer, boom, we got it. And
Okay. David, you're ready, right?
all right. You want to start with the Pledge of Allegiance? Okay. Well, why don't we have both boards call themselves to order first? Jeff?
Yes, welcome everyone to the Town of Hamilton Board of Selectmen and Board of Health meeting for Monday, March 30th, 2020. It's an emergency agenda meeting. I'll call the Board of Selectmen together with roll call. Start off with Bill.
Bill Olson?
Olson's here.
Rosie.
Rosemary Kennedy here.
Darcy.
Darcy Dale here.
Is Sean on yet?
Doesn't appear to be.
Okay. And Jeff Hubbard.
Okay.
David,
And,
would you like to?
Can you hear me, Jeff?
This is
Jeff, can you hear me?
Yes, I can hear you.
Okay, I'm back. I lost
okay.
my connection. I lost my connection. Here,
Okay,
Christopher.
no problem. No problem.
All right.
I had, just so you know, I had a good suggestion from one of the other calls that we should mute everybody who's not speaking so we don't get feedback on the recording. So I'm doing that for you all. All right, go ahead, David.
okay. This is David Smith, Chair, Hamilton Board of Health. We're convening this joint meeting, Board of Health, Board of Selectmen. Present, David Smith, Chair. Chris Small, are you present?
Hello?
Chris Small?
Yes, Chris Small.
Giselle Perez, Dr. Perez.
Dr. Perez present. Giselle.
Thank you. I believe we also have some board staff present, specifically Chris Lee.
Yes, Chris Lee present.
And Leslie Whalen.
Present.
Okay.
Great.
Joe, back to you.
All right, thank you all for coming tonight and being here and making the time for this important meeting. I guess we will start off with a Pledge of Allegiance. Joe, do you have the flag? You there, Joe? Uh-oh, we losing?
Oh, there you go. I got it. I have it right here. There you go. You want to start?
Here we go. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right.
Thank you, guys.
All right, no problem.
All right. We'll jump
Jeff, just so you know, Sean has joined us.
Oh, great.
Sean Farrell, you want to say hi? Sean, have you said hi? I'm unmuting him. He's not come. Here we go. Okay, here we go. We got him. All right.
There he is.
Technical difficulties. Sorry, everybody.
All right. Welcome, Sean. Okay. We will start off with board and committee openings.
Welcome. Thanks.
We have a Council on Aging opening, Hamilton Historic District Commission opening, Open Space Committee opening, Essex North Shore Agricultural and Technical School Committee vacancy, and this is actually appointed by the moderator. We typically do a 3-minute comment at this point. I don't know if there's anybody online.
So it looks like, Jeff, I have 3 people who are not members of the board or members of staff, so I'm unmuting them. I don't know their names. If anybody wants to speak up, you can try right now and see if you have comment. Hello? If you do, please let us know who you are.
Great. Thank you. Okay, at this time, we usually do the selectmen and town manager reports. We're meeting weekly now. I think we all know why we're here tonight. Does anybody have anything that they'd like to add? Bill, no? Sean?
So I'm going to unmute all the Board of Selectmen members just so that as you ask them, we can hear them. So.
All right, great. Sean, do you have anything?
No, not tonight, Jeff. Okay. Thank you.
All right. Darcy?
No, I'm all set. Thank you.
Rosie?
Just wanted to add a further opening. The Conservation Commission, I believe, still has an opening.
Okay.
Okay, great. And the only thing that I wanted to mention tonight was to make a special recognition of the fire, police, first responders that have continued to work so hard during this whole thing. the DPW department, and all the town employees and their families that during this time they're continuing to come to work, and while their families are at home dealing with a lot that's going on. So I just wanted to make sure that we recognize all of those town employees. Okay, we'll start off with David, the Board of Health Chair on Community COVID-19 Response.
Okay. Jeff and Joe, I created just a draft agenda to try to keep things organized. I made assignments for principal speakers, and let's start with item number 1. Chris Lee. Chris, you have the agenda item in front of you?
I do not. Sorry. Tell me
I'm
that.
sorry.
Chris, it says update on number of COVID-19 positives in Hamilton and Wenham and on contact tracing, case monitoring for positives and contacts among Hamilton residents, including the labor hours required versus budget.
Okay. So initially for cases, we had 2 people who were tested and then confirmed positive. For contract tracing, we have 3 as far as they have come in contact with someone who is positive, and then they are either showing signs of COVID or they're just on that 14-day wait and see period. As far as the number throughout town, there have got to be many other people that have come in contact, whether they've had a spouse, being a healthcare worker, and then you're just constantly sharing that same space, or they were unaware and exposed at a certain time. We have many people that travel for work out of state, out of country. So the people are here, but most likely managing from home. And the third piece that you asked was, did you say time that I would allot? Due to the fact that it goes 7 days, it could be anywhere from 40 to 50 hours a week. We only have 2 cases, well, the 5 total, 2 confirmed, and then the 3 contact. But today was a very mild day, so it just is fluctuating. The more people stay home and are prudent, the better my job is. The more people decide they need to go out and have a donut and breathe on their friends, the number will go up. Thank you.
Okay, thank you, Chris. The next item is that our board is invited to a weekly conference call hosted by the Commissioner of DPH, and I and all of my colleagues have found these weekly calls extremely valuable. So I want to ask Chris Small to update us on the most recent one and just try to summarize the key points from that hour-long conference call.
Okay. Round 1 of the state funding has been approved. That's $5,000. Round 2 is in progress. So Hamilton will be getting, with some luck, 10 grand in total so far, and hopefully more will be coming later on. Stop me if I'm running through this list a little fast, but there's a lot here. Physicians are in dire need of having some reserves, some assistance with case tracing and surveillance. States working to contact hospital programs, colleges, universities, to find students who can assist on working to do case tracing and surveillance on Maven, and relieve the burden of the professionals that are presently, like Chris, who is seeing the water swirling around her ankles at this point. It's like the waters are rising. And so with some luck, everyone will be able to get some assistance with case tracing and surveillance. The phone response time with the state is now at 90 minutes. Sometimes it's 0 minutes, but most of the time it's about 90 minutes. But you can leave a number and the state will call you back. So you don't have to waste time waiting online. The state is working on getting up a system of volunteers, retired professional providers to assist public health nurses. Hold on, I'm just trying to read my notes for a second here. So now the state has, order from the state is that the town public health nurse can share the identity and the address of an infected individual with an EMS dispatcher only, in order for EMS to know where they're going and who's got COVID-19. In addition, there were a few other minor things that were discussed. The boards of health can now delay non-emergency complaint inspections indefinitely. DPH is okaying reciprocity with regard to food trucks and their licenses. So if your food truck is licensed in Wenham, it can come to Hamilton. And the first drive-through testing site, which is a FEMA CVS site, is now open in Shrewsbury, and I believe that it's for first responders only at present. And that's that.
Okay.
Thank
Chris,
you.
I want to add two other key bits of factual information to this. In response to a question I posed, I took some comfort in learning that the DPH is able to turn around in 2 days or less collection of a sample from a patient and reporting to a town public health nurse a positive. That's really encouraging. It used to be a lot more. So the DPH in almost all the labs are now achieving a less than 2 day turnaround time. So when when Chris Lee is informed that someone's positive, that sample was collected less than 2 days prior. So we don't have to wait a week now. We get very, very rapid feedback. I was glad to hear that. A few other observations from all the data that I'm seeing. Originally, because the testing criteria were so stringent, dictated by CDC, the percentage of positives in the testing done was like 50%, was very high. That was because only the DPH was allowed to do testing. Now, the testing has been ramped up by a factor of 10 with all of the private firms all the private labs doing testing. And so the number of tests being run is just really ramping up. And as I expected, of course, that's going to ramp up the number of positives. But the ratio of positives to total tests, it seems to be ranging in the neighborhood of 10%, give or take.
I'm going to add something to that when I give my update.
So Dave, what are the new protocols though? The new sort of what if a citizen in Hamilton or Wenham wants to get tested? What are their? Is that something you can sum up in 30 seconds or less, just for people
Good
listening?
question. The DPH has published for our benefit a table of 6 categories of patients who either should be tested by the state or by the private labs. I'm looking at the table. The first 6 categories are ones that have got to be tested by the state. And when you look at the criteria, they're pretty stringent. For example, healthcare providers and EMTs who worked with a symptomatic individual, hospitalized patients with fever and severe acute respiratory illness, etc. So it's again pretty strict. But the state is now doing only a fraction of the testing. When you look at the patients in categories 7 and 8 who are maybe tested through the commercial labs, they're considerably less stringent. And so I'll give you one example. The last category is someone who is a symptomatic individual for whom knowledge of COVID-19 infection is medically indicated, including older individuals and those with comorbidities, and they have a fever or a mild to moderate respiratory illness. Those can be tested by a private lab. Still, in order to get any test done, you've got to go to your either primary care physician or nurse practitioner, get them to assess you and approve you for testing by, in this case, it would be a private lab. But the criteria today are far more relaxed, more lenient than they were a couple of weeks ago.
David, are they still requiring a common flu test before the COVID test like they were previously?
That I do not know. They didn't. Go ahead, Giselle.
Rosie.
Rosemary.
Oh, I'm
Yeah.
sorry, Rosie, do you know?
It's not required, but in many cases, flu A and B and RSV is done concurrently. But certainly, I would say maybe just in my particular area, about 40% of the time.
Mhm. Okay.
There are additional considerations with regards to the negatives that do come up, but I'll give those updates when
Okay. Okay, next item on our agenda is actually, Giselle, this is you. Update on the thinking and the anticipations of your world of experts on COVID-19. And you shared a lot of that with us yesterday morning, but go ahead.
Yeah, so just to give a little bit of context, so I'm a behavioral scientist at Harvard Medical School and at Mass General Hospital. So my world is really encompassed by working with scientists, epidemiologists, infectious disease specialists. I get a lot of information directly from the NIH. So I get sort of, and part of my job as a scientist, as a researcher, is really sifting through the information and trying to figure out what are ways we can communicate this effectively to a variety of different populations. And also understanding like what's happening in the here and now. So there are things that we are hearing, a lot of myths that I do want to dispel, but a lot of other concerns that I kind of want to raise. Some of the concerns related to those negatives that we're seeing, there are some data that we're starting to see that, so there used to be some concerns about the positivity. So if there was a positive, could it be a false positive test? That is less of a concern. So there's more confidence that now that if someone shows positive, that they are in fact infected with the virus. However, there are concerns about false negatives. So those individuals who test negative might in fact still be infected. So that's something. It hasn't been as discussed as prominent. You know, it hasn't been discussed widely. I don't think it should be, but I think for us to think about when we're thinking about what we want to do in our community, because it is something that's being discussed amongst our providers. There are a lot of unknown infections because not only the low risk of those who are considered to be lower risk are not necessarily getting tested, but there are people who have minimal symptoms that present more like the common cold. Those individuals are not reporting their symptoms. So again, those are populations that are carriers that are not getting tested and are likely spreading. The method of spread, we're learning a lot more about that. And this is what I discussed last we met. So we knew that there was droplet transmission. So somebody sneezes and therefore, you know, if you're in close contact, you're able to be infected, and also contact transmission, which is less common, but is still possible to aid an infection. But what we've been learning much more is that aspect of aerosol transmission. So aerosol is either solid or liquid particles that are suspended in the air. So that's why people have been turning to using masks. However, there are limits to the use of masks. So when you're seeing our providers, they're encouraged to wear, or they should be wearing PPE. So N95 masks, which have a specific fitting and they prevent entrance of aerosol particles, right? But other masks don't. So what that means is it will prevent you from droplet transmission. So somebody sneezes and you getting that basically on your face, or it will prevent you from touching your face. But if there is, for some reason, some virus in the air, then that actually can go through the mask. Okay, so I don't want our you know, when we consider what recommendations we're putting forth to people, I don't want people to get a false sense of security that suddenly, oh, I can go out and be next to my friend because I have a mask, because there still are going to be limitations, especially in confined spaces. So the incubation period is quite wide. We know that. We keep hearing 1 to 14. There's still some research, because this is a novel virus that's coming out, that this can actually be longer in some people, especially children. I've seen some ranges up to about 15 days, maybe a little bit longer. So, and there are people who can get better, but still shed the virus. So what happens, and what we've been seeing also in some of our colleagues, is sort of if you're thinking of a graph, the presentation, there are people who get really sick and then get better, right? So symptoms go low and they think they're fine and they might go out, but then symptoms worsen again. So they tend to kind of get sick, get better, and then get worse before they get better again. And that's why there are people who need to wait even after feeling well a period of time that they are asymptomatic before they're actually, out and about, which nobody should. The risk of asymptomatic spread is still real. So that's something for us to be concerned. And what our providers are continuing to tell us is that we're continuing to learn something new each and every day. So this is what I think is contributing to a lot of confusion in our community, because one day you can wear masks, one day you don't wear masks, one day you, and the reality is that we shouldn't make any assumptions other than this is a virus that can be easily transmissible, that can hide, and therefore we need to be cautious because we don't know enough about how it reacts or how it behaves. So those are some of the key things that I wanted to share. And right now we seem to be in certainly the acceleration phase. So when you're thinking about how illnesses peak, and that's what you've been hearing also on the news. And we do expect that peak to be in about 2 to 3 weeks. I think I gave you the really grim expectation that one of our lead medical directors actually anticipates that will look more like New York in approximately a week, a little over a week. Mm-hmm. However, that could potentially look better if we all do our part of not going out. And I think especially in our community, there was another important point I wanted to make, but in our community, even though we do see that there are people here, and that obviously increases our risk quite a bit, that risk will remain low if we remain physically distant. So I think we do need to kind of have a way of communicating that to our residents. And the last piece, again, I don't believe things until I hear it from my own researchers, is one of the things that has been coming out from our Harvard Medical School scientists is this aspect of changes in smell and taste. I don't know if people have been hearing about that. So that appears to be something that they're continuing to be an important marker of disease. So it appears that this virus is capable of attacking the key cells in the nose, sort of impacting the epithelium, and therefore that it has been used to explain why there's changes in taste and smell. So people who have these notice these subtle changes are actually encouraged to quarantine, because it could be that they're infected and may not have other symptoms. So that's new research that has been coming out. Again, it's unclear how much support there is, but this is sort of what we've been learning so far.
Okay. Thank you very much, Giselle.
Very informative.
Before we get to, I'm going to go down the agenda now next to Joe. Just want to pick up on a couple of data points that I forgot to mention. Something like 3 or 4 weeks ago, there was 1 case positive in Essex County. A couple of weeks ago was up to, I don't know, a dozen or 2. 1 week ago today, it was 70 some cases, and today it's almost 700. So we are clearly in the exponential growth phase of the of the incidence of this disease. Joe,
Yes.
Summarize the ideas that we discussed yesterday morning on our conference call.
Sure. A lot of the conference call yesterday was kind of around the idea that Giselle alluded to as far as, and Christine earlier alluded to as far as messaging and getting out to the community, the point that we need to continue to encourage people to physically distance, to stay home if they don't have a reason to be out, and to continue to follow all the safeguards. I think we talked about it a little bit more lightheartedly at last week's meeting as far as trying to get some videos done. And actually, David Smith has led the way today. He self-taped a short video of himself wearing, I think it's the fur of a Santa mask, a Santa hat as a mask, showing people that it would be better to have any kind of a mask on than no mask. And he played that on Facebook, and we've already had Bobby Gates pick that up and broadcast it. I've been working on some language for a couple of potential short 30-second spots or 15-second spots for me, and we're asking other folks to assist us. I've asked Chief Stevens. He said he'd be willing to do one, and even engage our school resource officer. And I've asked Superintendent Kuchenberger here because we were hoping to get her help or the help from the school district. I'm going to unmute Julie. I think I'm going to try and unmute Julie. And we're trying to get the idea is a message be delivered from multiple different people in the community to reach multiple communities within the towns. we don't always all listen to the police chief or the town manager or, whoever, but we might listen to somebody that we frequently hang around with for getting the message across, particularly to teens and young adults. Christine has, I think, volunteered the services of her daughter to help enlist a couple of teenagers to make videos. I think that's right, Christine. Is that right? Nod your head. Is that right? You're going to do that? So the idea that the teens will more likely listen to their peer group than they will to us. The suggestion was made today that perhaps Principal Tracy would be somebody that the kids would listen to. I know that the SRO would be somebody that they've listened to because they've done that in the past. And we're looking for other people to step up. So I will stop talking to see if Darcy or Chief Stevens can offer any further guidance or assistance on this. Part of this.
Can you hear me?
Yes, Darcy.
Okay, just wanted to double check. Yeah, I was very concerned about the projections that the New York Times made, and I forwarded that interactive map to you.
Yeah.
And it covers all the counties in the country. And so when you zero in on Essex County, it says if we continue apace, what we're doing some, social distancing mitigation strategies and things like that, that the Essex County can expect around 100,000 cases. If we did nothing, it would be over 400,000. If we did everything perfectly, right from the beginning, it would be about 7,000 cases. So maybe that kind of data can also serve to initiate some kind of response from people so that they're more responsible.
Sure.
As far as children, in the playground, young men playing basketball. I've been hearing that there have been claques of young people and just not understanding. But maybe if they have the math in front of them, something like that can galvanize people. And that's really all I wanted to say right now.
Thank you, Darcy.
Yes.
I think we're open to having multiple different messages with different things, and certainly using, some people will listen to the math more than they will listen to, David Smith. Some people won't listen to me at all. That's been evident. Julie, I don't know why you got muted again. Are you there, Julie?
Yeah.
Okay. Julie and Russ, if you guys want to take turns from whatever input you can to help us kind of do these. I think they're easy enough to do. You can do them on your laptop if it has a camera or your phone, and if you send us the 30-second videos, we'll get them out to our social media. We're going to host them on the town website. So
part of what we need to do, I believe, is and Darcy brought up a good point about the basketball, and I know we're going to discuss it at some point, and I don't want to take it out of turn. But we need to talk about Patton Park, as well as the playground up off of School Street, as well as the playgrounds at the elementary schools. We need to address that. You're always, Saturday was a beautiful day, and we had a lot of people, which was great to see people out of the house. Yes and no. But you had people on the tennis courts, you had people on the basketball courts, you had a couple sneak into the playground. So I think we're going to have to address that. And I think the best way to do it first is education. Let's educate the people. I'm not huge on enforcement for something like this. First I'm about education. Let's educate everyone. And, we need to discuss whether, the BOH needs to discuss whether it would be prudent to shut the whole place down. You did shut it, you partially shut it, which is very hard for me to send people down because I don't truly know what is closed and what's not. Can Russ Stevens and Bill Olson, well, not Bill Olson, the shoulder now, play a one-on-one tennis, but can Russ Stevens and Jeff Hubbard play one-on-one tennis? Is that allowed? Is that not allowed? Can Russ Stevens and his son play basketball because we're isolated together? Is that allowed? Is that not allowed? There's a lot of questions that are being asked the way it's partially closed now. So that should be something we discuss at some point to close that down. Also keeping in mind that, we can try to enforce this and make martial law. That's problematic somewhere down the line. My thing is let's educate everyone first and then ramp it up to the enforcement end.
Yep.
Makes sense.
I would just add that something that's been happening in the communities near where we live is that they've actually like caution taped off the playground areas, which although we know, I mean, it's just natural instinct for a kid to run to a playground as soon as they see one. So I think that's a nice visual reminder that, and I've also seen, now all the parks are closed, so you can't even go and walk around. But, you know, last week when we still could at least walk around, there were signs that said, you know, ordered by the local, like Board of Selectmen, you know, blah, blah, blah. So it just was like another visual reminder of, you know, the seriousness of things, because, you know, even in my own neighborhood, my neighbors are constantly saying, let's all go out for a walk and we'll practice social distancing. But then I look out the window and they're not. They're like all clustered together, chatting and whatnot. So I just think it's a hard habit to break, because we're so used to interacting with one another in a close way, that any visuals we can create will help people do the best that they can.
Good idea. Yeah.
So, so I think that we'll continue to work here at Town Hall with Bobby and whoever else wants to volunteer to help us with the videos. We'll produce them. We'll get them out. We'll variate the message a little bit. Again, I think I made up that word. I made it up yesterday, right, Cass? And then I'm using it again. But we'll continue to vary the message and try to get it out there in different forms through different people. And I'm open to having all of you help if you can. So just send me an email later on that you want to help, you want to say something that's great, or if you know somebody that you think might be a good messenger for us to a particular group in town, I'm open to that as well. Why don't we talk a little bit about what, this was also a subject of the call yesterday too, so it kind of belongs in this part of the meeting. Talk about the idea that Russ just raised about having a little bit more far-reaching closure of the parks. I did invite Anthony and Saldi from Wenham to be on the meeting today too. He's here. I'm going to unmute him right now in case he wants to offer something. I think we want to try to, because of the parks situation shared so much between the two towns, we want to try to be on the same page as Wenham. And I believe they're having a Board of Health meeting Wednesday night. So let's talk about what you guys think might be possible and what we could ask Anthony to carry back to their Board of Health so that we can have an aligned message.
I'm hearing loud and clear what you're saying. I certainly can bring this back to the Board of Health, as well as Jackie, who's on the line too. We echo some of the same concerns. I think Chief Stevens makes a lot of sense as far as being very difficult to enforce. We certainly don't want to put our officers in harm's way by leaving the cruises and interacting with people. So, but that's something that the Board of Health is going to take up on Wednesday as well.
So I just have a comment. When I went by over the weekend and I saw just several kids playing basketball, I looked the next day and there were not any signs prohibiting close contact. So I'm wondering if some laminated signs with just a few choice words could be posted there to help remind people as they come on to the courts.
Sean, you're online now. You can.
Yeah, I can jump in. So we do have signs at Patton at all the playgrounds and all the parks. The signs at the playgrounds specifically prohibit any use of the playgrounds. The signs at kind of away or at the fields just ask folks to practice good social distancing techniques, when using those facilities. So I think what we're finding, or what I guess happened over the weekend is, folks are not practicing good social distancing techniques. So now the question becomes, do we take it a step further, than what we previously had last week?
I mean, I think it makes sense.
We do have, and I think, the weather kind of right now works in our favor where, we have some rain coming up over the next few days to kind of work it out. But, the warmer weather is going to be coming. So I think, if that's the case, that we want to move forward and do something a little more than we have in the past, we do have a little bit of time to get that implemented.
Yeah. Sean, I just wanted to add, I did see a sign prohibiting or notifying people in the playground itself, but I didn't see, I think there was at one point a sign
yeah.
along the basketball court.
Mhm.
And I didn't see that the last two times I drove by. So I don't know if it got knocked over, but I just
I
wanted
wouldn't
to
be
mention.
surprised if something happened to it.
Well,
Sure.
what can we
But
do to
the
make
signs went
what,
out maybe, I don't know, Jack, maybe a week ago or so. I think
what can we do to
Yeah.
make it? I
Right.
mean, I think we need to make it. I think we need to listen to Chief Stevens. I think that's the problem is that we're worried about signs. I don't think we need to worry about signs. We just make a blanket statement that the parks are closed. They can go on the trails and they can walk the streets and walk sidewalks and go for walks. But I think leaving
Yeah.
the parks open is creating way too much confusion, and it's not really leading by example. People drive by and they don't know who's out there and what they're doing and why they're doing it. So
Yeah,
I
I
think
think
Well,
signs
so
is
if
just a
So if
problem.
either or both boards wants to take up a motion to kind of extend the closure of the parks to include the playgrounds and the fields or something like that,
And
or
the
the
tennis
basketball courts and the tennis
courts.
courts.
Yeah.
And we did have an internal discussion today where I think Tim and Russ and Sean all talked about, at least on the Hamilton side, putting a padlock on the tennis court gates, taking and zip tying the nets at the basketball court so that they can't be used as basketball hoops. I know in one town I saw they just took the hoops right off the backboard, and
Yeah.
good luck playing basketball without a hoop.
Yeah,
We
some
could
people
we could
take
take
it.
measures like that that would really just kind of prohibit them being able to play, and then we'll release the statement through social media and through the town Facebook page and things like that. There is another option that I don't know that anybody in our town has the appetite for, but I did share by email this morning what the Board of Health in Salisbury did. I know Salem, Swampscott did something similar. I have asked Tom McEnany to be on the line. He is here, just in case you have questions. Salisbury and Swampscott tied a Board of Health order to a section of state law that basically says that if once the Board of Health has acted and said that this subject is closed, if people continue to gather there, they could be subject for a fine of up to $1,000. Again, they took that extreme measure more to get people's attention and drive home the seriousness of it. From talking to the folks in those towns, I don't think it's their intention to actually write too many $1,000 fines, but having that out there as a possibility certainly raises attention, raises awareness about the issue. You put that out there and it'll definitely be on Facebook that it'll get around that way. So again, I don't know that that's the way you want to go, but just thought I'd let you know that that was a possibility. And for those who can't see, Mary Beth Ting's joining us from Wenham. Hi, Mary Beth. You're muted currently, but if you need to speak up, let us know.
I mean, once again, the magic of this is not underreacting, not overreacting, but the problem is did 10 times in a week. So if we wait another week to make another, that's 10 times again. So I don't think we can mess around with sort of being nice and kind. I think we just need to make broad stroke decisions that are in the best interest of our town and our citizens. So
yeah, I think that's, I mean, I'll make a motion, but I think that we should, tape off the playground and stuff, put up the new signs. They even take like the swings off, the swing sets and stuff like that. A lot of other towns have done the same thing.
Yeah, we can tie the swing sets together. Or we can completely take them down either way.
Yeah, whatever's going to send a message. Right now it's kind of, you've got the barriers up and people can still go in and everything's kind of like business as normal and when you're there. So this will kind of really show you that we don't want you in there and close to each other. So I'll make a motion if everybody's okay with it to close the parks, playgrounds, and fields in town.
Second.
Any further discussion?
Chief Stevens, is that a good enough description? Do we need anything more? Do
I need to put a date or to be determined per COVID?
So this is Tom McEnany. I would suggest that you do it as of a particular date because it's going to take obviously a little bit of time to kind of coordinate, whether it's tomorrow or Wednesday at noon or something like that, to give town staff the opportunity to take steps necessary to close those particular facilities. Also, if you close in parks just generally, I think, which is fine, you certainly have the authority to do that, in my opinion. But if, like Patton Park, for example, where there's large areas where people could potentially walk without being close to each other, that don't involve playing fields or basketball courts, tennis courts, playgrounds where there would be a much larger a much bigger chance that there would be close contact than, I don't know whether you want to accept
Yeah,
those
courts,
types of
fields, and
areas
playgrounds
or
makes sense to
exactly,
me.
but you certainly have the authority to shut it all down if you believe it's in the best interest of the town to do.
I'm in favor of courts, fields, and playgrounds, but I'm not sure if that's enough definition. I think trails should be left open, but
Yeah. I mean,
Yeah.
I think we've got enough open space that people don't have to use Patton Park. We've got plenty of places in town to go to. And
I
if we
agree.
Patton, it sends quite a message to the community.
So I think, and this is related to this discussion, but part of what Chief Stevens has said, and I think we really should move forward with doing this, is this aspect of educating, because I think we take away, but when you're thinking of human behavior, you have to give something in return. So I think people are only going to see they're taking all of this away, and I don't know how to replace it. And you see this on Facebook when people sort of rebel and they're getting angry. So I think part of what we have to do is educate. And I think, we discussed maybe doing a virtual town hall. That doesn't seem to be very popular, but I feel like it's an important point where we need to be able to hear from our residents and provide answers to their concerns. So educate based on what their specific needs are, because we can't always know and make these assumptions. And basically there are people who might say, like, what is physical distancing? I thought I was doing it right. And here I am getting in trouble, and now I can't do X, Y, and Z. So close these places off, but then offer them something in place that they can do to keep their mental health stable.
Right, and I agree, and that's what we had said, to make sure people know that the trails are still open.
There's a great Discover Hamilton trail map that's out there. We could maybe put on the website.
Can I offer that, since I picking up on Tom's suggestion as well, and knowing that Dr. Kuchenberger and Mary Beth are both on, the Wenham Board of Health is going to have a meeting, as I said, I believe it's Wednesday evening or Wednesday afternoon. Could I ask that you amend the motion to be effective Thursday at noon, and that'll give us time to do some education about it? Can we ask if the superintendent and Mary Beth think that their respective agencies would be able to align with this, so that we're kind of all on the same page? Is Julie willing to shut down the playgrounds and parks at the school control? And does Mary Beth think that the Board of Health in Wenham will be open to this, I guess?
So for the school department, absolutely. We will do our part, and we can remove the swings on our playgrounds and rip them off in the same manner that you're doing it throughout the town.
Great, that's helpful. Thank you. Mary Beth, what do you think the Board of Health there is going to think? Not that you speak for them, just to get an idea.
I need to be very clear that I'm employed by the Board of Health, and although I'm married to the chair of the Board of Health, I don't speak for the Board of Health. I know that there was some discussion, not with the board, but with town administration and public safety today, real concerns about the rail trail in Wenham. It is getting very, very, very crowded. So I hear you saying you're not interested in shutting down the rail trail, but Wenham has some real concerns about the rail trail right now, because if anybody that drives down that way, you'll see lots of cars parked all along 97 for access, both northbound and southbound. And with the tragic death bicycling on 97 in Ipswich over the weekend, I know public safety is really concerned about that access point and about the amount of traffic that's there. I have walked my own dog there, and I'm not interested in seeing trails get closed down, but it is a concern when you have so many people gathering there. We still have a bit more to learn about aerosolization and some discussion about, what's happening when people speak to each other, which is why the distancing is so important. So I know that we've already, since Joe, you're probably aware, they've already voted to have the signages up that the playgrounds in Wenham are closed, right, that the fields are open, with the signage that says, please do keep your distance and don't do anything with contact. So we're in accord with what you're proposing right now. And potentially, I'm not sure what the board will decide to do with the selectmen the board will decide around other public ways for access.
So you may go further than fields, playgrounds.
And courts.
And courts, and include the rail trail.
All I can say is that it was under discussion. It was a topic raised of concern today because it just, over the weekend it was nice weather and there were so many people. Well, maybe it wasn't the weekend. I'm losing track of my days. I'm sorry. There were some really nice days last week and it was incredibly crowded. And I did go for a walk with my daughter and I thought, I think this is the last time there's way too many people here. It's, very crowded. And some people, it was really disturbing to watch as I'm looking, thinking, I don't think those 8 people are probably all one household and they're walking in a clump together. My daughter and I, we're one household, we're sharing the risk together. But when you've got like 10, 20 somethings with their kids, are you really all living in the same household? Or are you just, combining and then spreading as you go?
So this is what I meant by access, because I think we don't want to overburden. I think that there'll be a considerable concern if we limit people's exposure to outside. I think people are gathering because they don't understand what the risks are. Even if you're outside, that there's still a risk of contracting the COVID-19. But I think being able to give other routes, like my family and I, we go to Gloucester, and it hasn't been as populated, but we are finding different routes where there's an absence or fewer people and we're still outside. So we are confidently at a distance. But I think if people only know what's available around them, then that's when you're going to get a cluster.
That's very true, and I was going to suggest that on social media we could talk about other possibilities. Greenbelt has advertised that their properties are open. There's
Essex County Trail Association.
Right, Appleton Farm is open. The grass rides. I mean, certainly are.
Appleton Farm's the trustees' property, right? Trustees closed all their properties.
Yeah, they're closed.
They
closed
did.
all their properties.
So
properties have been closed for.
Okay, so Greenbelt, that's still open.
Greenbelt is still on Essex County
Trails
Association. Yeah. So there's still ample trails. We just need to divert people to those other options. I think David did a great job today of reminding people that though DCR had closed parks, they didn't close trails, and Bradley Palmer State Park is still available to be walked on too. So I believe David Smith did that today as well on Facebook. So he's been busy today.
So, Chief, does that help you out at all? I mean, you're come back to your discussion, but we're saying, fields, courts, playgrounds. Do we need to be more? Give us some more direction.
I do agree with Giselle that if you don't give people some out, they're going to go crazy. Now, we in the policing field, we always worry about an uptick in domestic violence. We always worry about that during the holidays, during winter seasons, because you have people that are in the same house together. Now, we haven't seen an uptick in that type yet, but we're in the policing field, we're always worried about it. That's where the out to get outside helps. So in Hamilton, and I can't speak for Wenham, and I do fully understand what Mary Beth is saying about the rail trail, because I was in Topsfield walking the rail trail on Friday, and I just couldn't believe, I've never seen that many people on it. People need to be able to go somewhere. So if we shut down Patton Park in its entirety, I mean, you still need to let people go, and they're not going to stay inside their house. At that point, like, if we're going to shut down the parks, Board of Health should come out with a code red message, and in that code red message should be telling people we're shutting down the parks, but give them an out. We still encourage you to walk the green belt. We still encourage you to do this, and kind of direct them where you want them to go. You can't lock them up in the house. That's not a good thing. And we haven't hit martial law, and God forbid we do, but we haven't hit martial law, and that's what it's going to seem like to people. And people's tendency, they'll push back, and I'm worried about that. I'd rather give them some sort of an out.
Right.
One of the things that was a real concern with discussion about public safety as far as the Wenham Rail Trail is the dangerousness of the parking situation. And I can't speak to either ECTYA or Greenbelt Properties, but I think one of the concerns is really making sure that people have safe places to go, safe places to park, because there have been lots of families with kids with bikes, right on 97. And so it's just getting a little scary, the number of people and the traffic and that kind of thing. So I think that would be one thing to try to address is, give some guidance around, don't just park roadside, and have your kids out on the street while you're trying to get into whatever the property is. That was the real concern, I think.
Much like your rail trail, like for Patton Park. Not everyone that goes to Patton Park are Hamilton and Wenham residents. When we first opened the playground up, we used to see people that were coming from, I've never even met them. It's like, these are people that are coming from out of town, and we still, without IDing everyone, there is still a large group of people that have come from out of town. So I think we may be at a point where we have to shut down the tennis courts, tie up, as much as I hate to say it, tie up the basketball courts, caution tape around the playgrounds, and put the barriers up, just leave the messages and not to use it. And walking across the field is not so much a concern. I think we were out there Friday, there was a father and son playing on the tennis courts. And they're together socially, which is great. But those are the people that are going to be negatively affected. Those are the people that are going to have to play basketball in their driveway type of thing. We get a lot of people out of town, much like the rail trail in Wenham. We get a lot of people out of town that use Patton Park, and they know about it. And it's a great place to be. We just need to shut that down now. And this Saturday, there were a lot of people there because it was a good weather day. Fortunately, now we don't have good weather, but it's right around the corner, and that place is going to fill up. According to the conference, we're looking at between April 7th and 17th is going to be the surge now. That's what we're seeing now. And I leave that to the medical professionals. So it could be the worst is yet to come. So I think we need to shut that playground down now, that park area down now, and give them other routes. And if David wants to write something up, if the BOH wants to write something up, I'll work with David and push something up through Code Red to limit that. And then after that, then I can do a little more talk about enforcement. Education first, enforcement second, and then I can talk about the enforcement aspect. And I can always put a cruiser down there. It doesn't go along with the community policing model, but I think we're beyond that now. But I can put a cruiser down there and just kind of move people along.
So, Chief, are you suggesting that we keep Patton Park open, just close down the playgrounds, the courts, and the fields?
No, I'm saying shut the whole thing down, Jeff.
Okay.
But if someone's walking through there, we're not going to chase them out of there. I don't want us to be the strong arm of the BOH and say, okay, we're going to shag everyone out of there, like get out of there. If someone's walking through and we see them, hey, listen, you can't go through the field. It would be hard pressed. I do not want to get involved. I do not want to see us actually. It's nice to say there's a law there that we can use to enforce if we have to, but I'd rather not go that route. I'm saying shut it down completely. But talk about the trails. Talk about different avenues that we can.
Exactly. Yeah, because people are still going to walk through down the kind of side road on the backside of Patton to go to the schooling fields to take their dogs. A lot of people have been out there lately. So we don't want to prohibit all that, but we want to just still shut everything down. And if people are going to go there, we don't need Russ down there every 5 minutes kicking somebody out, but we want people to really have a public awareness that they should really be social distancing and staying out of the park and off the playground.
So you don't have anything else to do, right?
Yeah, nothing.
So amend the motion to close down every field, court, playground in Hamilton, including the entire Patton Park.
Starting at noon on Thursday. Until further notice.
Okay. We'll have to do a roll call vote. So I take it you want both boards to vote on this?
I think so.
Okay.
Is there any way we can do this sooner than Thursday? I just see numbers climbing.
I mean, could we put out a notice on the website and then have it kind of enacted on Thursday with signage and kind of the mechanics of it? Or is there...
I think that we could. Chris, the only reason I recommended Thursday noon because I didn't want us to be seen as acting unilaterally and not in concert with Wenham. Wenham's board's not going to meet until Wednesday, so I was hoping that for the official, documentation, we'd be aligned with them. But we can certainly, Sean's on the call, Russ is on the call. They know what our aim is here. We can certainly start making our preparations tomorrow and we can at least go the step of taking the basketball hoops down, putting the padlock on the tennis courts, starting to prepare the message that goes out. Does that kind of seem okay?
Joe, or Russ, can you do a code red tomorrow? Because lives are at stake Lives
Yeah.
are literally at stake, and every day that goes by where we don't observe those practices, people are going to die in this town. And I hate to put it so bluntly, but frankly, that's what we're talking about.
So we can do it effective. It's not a problem if the board wants to do it effective Thursday at noontime, the park is going to be closed. We can do that. We can send it out. The only thing about Code Red, you don't want to send too many, and Joe knows we have this conversation, you don't want to send too many Code Red messages because then it loses the effect of a Code Red message.
Yes,
so you don't
the pandemic that has exploded into an epidemic, and we are in uncharted territory.
Yeah. I think we always plan to use the Code Red for this. Yeah, we'll work on the message tomorrow. We'll start making the plans.
Right. Well, the playground's already closed and the basketball already closed. So you can start to take this and do your, those things have already been closed. So we're just.
I don't think there's any reason why we can't put the padlocks on the tennis courts, zip up the basketball nets, take
swings.
That's. I mean, there's no reason why we can't.
And Joe, Joe, I'll follow your advice on whether to do Wednesday or Thursday, but the sooner the better for me.
Yes.
So.
Just to put it into context, though, we have a rainy day today and a rainy day on Thursday. So Tuesday and Wednesday are only sunny days. So the likelihood is people are looking at the weather and they're planning their outings. So putting that out there too.
And
I've been looking at it closely.
Yeah, me too.
BOH, correct me if I'm wrong, but the BOH already shut down the tennis courts.
That's correct,
the basketball courts. So as much as I never thought I'd stay in 11 years I've been in the town as a chief, throwing the padlocks on the gates to the tennis courts, that's already acceptable. The wiring up the hoops on the basketball courts,
it's already acceptable.
And that will deter some of your public from going there. Getting the caution tape and wrapping it all the way around, all the swing sets, posting more signs, then we can do that and then make the announcement still on Thursday at noontime if that needs be. But we can definitely do that. Take those steps. Reposting signs, we can definitely do that. Take stronger steps. We can do that.
Yes.
Good.
Okay.
Can I also add, when I spoke to my teens about the possibility of the $1,000 fine, and they said to their friends, there's potential of this happening, the feedback was that will stop kids from gathering just like it stopped kids from vaping. They said the fact that you put a fine on it makes kids get this feeling of, we don't want you to take our money. They all three looked at me and said, we'd rather have you fine than, we don't want to make a masking video because we're going to look funny. But if you talk to people about a fine, especially high school kids, they had more of a feeling of, this is really serious. Don't take our hard-earned cash.
So I'll work with David Smith and develop a message that we can push out, and we can kind of tag team it together, that Chief Stevens and the Board of Health Director, and we can tie in that $1,000 fine. We can, similar to what Salisbury did, and I already spoke to the Salisbury.
Tom, does there need to be an official vote by the Board of Health, or does chapter 111 section, I can't remember it now,
122.
Yeah, 122, does that cover us without a vote?
Well, the Board of Health would need to vote. It's General Laws, Chapter 111, Section 122, which is a Board of Health statute. So the Board of Health should take a vote to essentially close the parks, playgrounds, courts, etc., similar to what the Board of Selectmen is in the process of doing now. I would also recommend that they adopt a specific fine schedule, because right now, the way the statute reads is it says that you can be fined up to $1,000. So I know some like, for example, I believe the governor's order specifically said, like, for the first offense, it's a written warning. Second offense is like $100 fine. Third offense is a $500 fine or something like that. So I would recommend that you have specific penalties that attach either, it can be for any violation. You can just say it's $1,000 fine, or for first violation, it's X, second violation Y, third violation Z, or however you want to do it. But in my opinion, there ought to be some
consequences.
Specific consequences in terms of because otherwise it just, there's there's just no real standard that would be applied by either the Board of Health or any enforcing officer to, where it would just be completely discretionary. Where, okay, one person might get $100 fine, somebody else might get a warning, someone else gets a $500 fine. There's just no real kind of ability to guarantee that there'll be some sort of uniform enforcement across the board for any violators. And I would say, Joe, as you had indicated earlier, that the intent in some of the other communities that we represent who have adopted these types of orders has really been more, it hasn't really been, at least from what I've been told, an intention to really enforce it in the sense of issuing tickets and fines to people. It's really been more of a messaging effort to just try to get across to folks how important social distancing is and how important it is to to stay apart during this time period in order to limit, to the extent possible, the possible transmission of the virus. So it's been more of a, I would say, a messaging tool as opposed to an actual enforcement tool. But it does give you that option in the event that you had somebody who was particularly recalcitrant.
All right, can I suggest, and Tom, tell me if this is a bad suggestion, but can I suggest we take this in two parts? We've already got a motion on the floor. It's been seconded by both boards. We're ready to do a roll call vote on that. And then perhaps the Board of Health only could vote on the idea of having a fine structure and leave that to chairman to or work out what that fine schedule will be to be released with the public information and a separate vote of just the Board of Health. Does that seem reasonable?
Sure. I think the board would vote specifically on what the Board of Health would vote specifically on what that fine schedule should be.
Okay. All right. So let's start with the first.
I think you can take this vote first and then do a separate vote on that.
All right. First question on basically on what Sean and Bill, I believe, motioned to close the parks, playgrounds, and courts, and fields, playgrounds, and courts,
field edge courts, yeah.
and all Patton Park effective Thursday at noon. But to begin taking those things, locking those things up tomorrow, and just by roll call vote, Sean Farrell.
Sean Farrell, aye.
Bill Olson.
William Olson, aye.
Darcy Dale.
Darcy Dale, aye.
Rosie Kennedy.
Rosie Kennedy, aye.
Jeff Hubbard.
Jeff, aye.
Okay, that's 5-0 in favor. On the Board of Health, David Smith.
David Smith, aye.
Giselle Perez.
Giselle Perez, aye.
And Chris Small.
Christopher Small, aye.
That's 3-0 in favor. The motion passes on both boards. All right. Is there a motion from somebody on the Board of Health regarding the fine schedule?
All right, I'll move that we institute a fine schedule for violations of that prior motion that consists of, number one, first offense, a warning. Number two, second offense, a fine of $500, and number three, third offense, a fine of $1,000.
Is there a second to the motion?
Is it for discussion?
Well, you have to have them. You have to have a motion on the floor in order to be able to discuss. So, second by Chris Small. It's now available for you to discuss.
I agree that the best deterrent for behavior is obviously a fine, risk aversion. But I feel very strongly that people don't understand what we're asking them to do. So I feel that with that, there needs to be a very consistent and thorough messaging about what it is that needs to happen and why. And I do think that people are not going to like this fee. So I do think that perhaps I would feel more comfortable if that first, after the warning, the fee that they would have to pay would be somewhat lower, and then increasing it for a follow-up offense, because at that point there'd be an obstinate. And I think that that's an outward kind of indication that they don't want to abide. But I feel like there needs to be a chance for people to make a mistake.
Okay.
So the first offense is a warning, is a warning and no fine. The second offense is $500, and the third offense is $1,000.
Could you say up to 500 and up to 1,000? That way there's a little bit of room in there, but it's seen as a serious thing.
All right.
This is Tom McEnany. I would not recommend doing that because, again, I think you want to have a specific ability to enforce this in a uniform fashion. So you don't want to have a situation where it's left essentially where if somebody commits a second offense, someone might get a fine for $100, someone else might get a fine for $150, someone else could get a fine for $500. So I think it really needs to be uniform across the board. So if you want to make the fines lower, you certainly could do that, or you could institute, more kind of steps, I guess, where written warning for the first one, for second violation is a fine of X, third violation, fine of Y, fourth violation, or any subsequent violations, a fine of, Z, whatever that may be.
All right, you got to keep it simple. You can't
Joe,
keep it complicated.
Joe, let me amend. I'm going to amend my motion as follows. First offense, a written warning, along with providing the offender with educational information explaining why, and recommendations for alternatives. The second step, fine for a second offense would be $100, fine for and additional educational material. Fine for the third offense, $500. Period.
Well, David, I was just about to suggest the exact same thing with the warning offense, which would be an informational sheet that explains what's going on and why we've taken these steps.
Okay.
I'm very much in favor of that.
Is there any other discussion? All right, on the second motion as amended, Board of Health only, by Chris Small.
Joe, sorry, Tom McEnany again. One more thing. I think if the board of Health's intent that in addition to the health director or public health nurse, that this would be enforced by the police department as well, or who's going to be enforcing this?
Is it possible? Is that possible? Because I think that would need to happen. I think if you issue this warning and it's not followed through, that it has no validity.
Right. No, I guess the question is, so say, for example, a police officer is driving by Patton Park and there are people out there playing, flag football or something like that. Then would the police officer be able to essentially enforce the Board of Health's order by issuing a ticket? Or is it something that the police department would then observe, ask people perhaps to disperse, and if they don't, call a Board of Health agent to actually enforce the order? It gets a little cumbersome because it's technically, it's a Board of Health order. The police department generally is not an agent of the Board of Health. So I think if for purposes of enforcing the order, in my opinion, I think the Board of Health could specifically request and include that the police department would serve as enforcing officers for the purposes of this particular order. But as you know, as a general rule, the police department would not be responsible for enforcing health orders or health code violations and things of that nature.
If David adds language to this, if David or one of the BOH add language to this to allow, Tom, to allow this, questions directed to you, to allow the police department to enforce this, would that suffice? Because I don't know if we have language in our current bylaws that allow the police department to do this if they don't give us that.
That's right. Yeah, no, Chief, that's exactly what I was suggesting here, is that I think if the Board of Health intends and wants the police department to enforce this particular order, the vote ought to specifically say that that's how this is going to be enforced, is through either Board of Health agents or through the police department.
All right, Joe, then I'll amend my other amendment further as follows. The Board of Health now directs, now authorizes the police department of the town of Hamilton to enforce this order along with the Board of Health, the agents of the Board of Health. Is that, Tom, does that do it?
Yes, it does. Thank you.
Get a second on the new amendment.
Second, Chris Small.
Okay, now is on the motion as amended twice. Don't make me reread it. Chris Small, Board of Health.
Chris Small, aye.
Giselle Perez
Aye. Giselle Perez.
and David Smith.
David Smith, aye.
Okay, so that passes. Chief, well, I'll work out the logistics with you. I thank you all for doing that, Tom. Thanks for pointing that out. We don't have any full-time staff in the health department, it would have been really difficult to enforce this without extending that authority to the police department. So thank you both for being willing to do that. I appreciate it. That'll make it a little easier. And again, we'll work with David and Chris Lee and Leslie Whalen to develop the educational materials that would go along with the first written warnings in the event that we have to write any. I think once we publicize that people are going to get fined, you're going to see a lot less activity on this anyway. So,
Joe, if I might, if we can get the BOH to write something up like you just said, and in that, Chris would be great to put, this is the threat, so this is what we're looking for. And then if we could also add options like the green belt and all these other options that they can use in lieu of, the officers can start handing those out as soon as we get them. We can start handing those out to anyone we find in the playground.
Okay.
That would be great. And also, as we discussed, we could talk about tomorrow moving that signboard in the
into the parking lot. Yep, into the parking lot at Penn Park. Great idea. Both those are great ideas. Thank you. I just want to take a quick note and I'm going to publicly thank Dr. Kuchenberger, who has already sent an email to her facilities director, informing him of the steps they need to close down the parks and playgrounds associated with the school. So thank you, Julie, for helping out with that. I appreciate it. And I'll clarify what Russ just said. When he said Christine, he meant you, not Chris Small. Earlier today on an email, I said Chris, and Chris Small was saying, I hope that you meant Christine Lee and not myself. And I believe that's what Russ was saying there as well. So I think that wraps up that part of the agenda. David, you want to take the meeting back over? We've gotten through enforcement of issues on local bans and restrictions. So.
I'm sorry, Joe, I just misunderstood. You want me to pick up where I left off on the agenda? Is that what you said?
Yeah, both things that you had attached to my name we've gone through, it looks like to me, unless somebody feels we've left anything out. And, you can go back into your agenda and then we can go back to the town agenda afterwards.
Okay, just one last item on my agenda, and that is, I've got an interesting sounding board now from the town residents who pay attention to the Hamilton Wenham Residents Only Facebook page. I've criticized it a great deal in the past, but there are times when it can be useful. So I've got a lot of good feedback on the several things that I posted over the past week. A consistent theme has been along these lines. I can't believe our young folks are still whatever the word would be, getting together in tightly knit little groups and completely avoid just paying no attention at all to the 6-foot distancing concept. And what do they think they're doing? Do they not appreciate that they're jeopardizing everybody's health? So that's been a consistent theme across the board. And I'm hoping that what we've done here is going to help alleviate some of that. More of it, I think the most common kind of response that I've gotten is, this is great, I'm glad you're doing this, I think it's overdue. We really have to work hard at trying to beat this COVID-19. So there's really, I think, kind of an almost overwhelming community spirit in favor of what we're doing. That's been the gist of it.
When people say young people, are they talking school-aged young people? Is it more college-aged young people?
Julie, I would say what they're probably speaking of age group between about mid-teens, like 14, 15, 16, and up to 20, young 20s in that. So that would be high school and maybe even young college.
Okay.
Anecdotally, I'd say that it's similar to what other communities are seeing. A lot of the town managers we've talked to are wrestling with similar challenges. Kids under the age of 8, 9, or 10 are generally pretty well in command of their parents. Their parents tell them what to do, and they pretty much do it for the most part. Above 10, starts as those of us who have 12 and 13-year-olds know, it gets a little bit more dicey. And then certainly by the time they're 15 or 16, they think they know everything. So we have a little bit more of a challenge of getting the message to them. So.
Yeah. And I'll leave it at that. It's been an experience to collect all this feedback and assess it and try to understand what's going on in the minds of our residents. So I think the good news is the gist of it is all very positive, and where residents see mostly kids not complying, they're upset.
So I'm just wondering out loud, David, if maybe one of the PSAs, and maybe this is one that I do as this element, the K through 12 superintendent, is 2 young people. And I think part of what might be hard is that initially a lot of what they might have heard in the news was that young people aren't being affected or being affected. Well, now the data is telling a different story. So Giselle, maybe there's an opportunity for you and I to partner on creating a message that's not necessarily like fear tactic, but fact, maybe like a fact tactic, and just saying, like, we know that the media was saying this, but that was before we learned all of this. Because if they haven't been paying attention to the news and seeing how this COVID-19 is evolving, they might still think that they literally are invincible to it.
Yeah, and Julie, I want to just pick up on that. Yesterday in our call, I thought Giselle had a terrific point to make, namely that adolescents will listen to and pay attention to their peers that they respect. And I think you and Giselle perhaps could best try to identify who are the thought leaders, who are the social leaders, the respected people in those mid-teens age groups, and use them to broadcast our message.
I agree.
I think Giselle really nailed that one. That's the most effective way to do it.
And I think so. Thank you, David. And I was actually going to suggest Dr. Kuchenberger. I agree. I think it would be great for us to maybe identify those key peers, because as adolescents, who cares about adults, right? But then also there are some, I think there are actually adults probably that many of them do respect, and they're likely to hear messaging. So if there are, so kind of attacking this from multiple fronts. So is there a peer who feels confident enough to convey this message to their peers? And then also, is there someone in the high school who tends to, like, often it's a coach or someone else who they tend to respect? Can that also be a person who is a point of contact and can communicate this message?
Yeah, definitely. I'm thinking of a couple students and teachers right off the top of my head. But I will work with the high school principal to see what we can pull together.
Julie, if the SRO would be a help, by all means, just reach out to me if that's someone you want to throw up there. I know he's got a little bit of a following as well. So if that would work out too, I mean, by all means, just that we'll throw them your way.
Okay, perfect. Thank you.
Thank you, Julie.
Thank you, everybody. Yeah, that's great. I like to see the collaboration. It's helpful. I see us all pitching in. It's a tough time, and more hands on deck, the better off we're all going to be. So thank you, everybody.
Okay. Joe, I'm finished with my agenda. It's up. Ball's in your court.
All right, Jeff, we're back on to the second item on our agenda.
All right. Hey, first of all, David, Christine, Chris, and Giselle, thank you so much.
And Leslie.
Leslie's here, sorry. Update on local government operations by Joe.
All right, I'll try to be brief. Most of you have an idea of what we're doing already, but since this movie is being recorded and will be later broadcast, if it's not currently going on over YouTube, which it may be, we think so. As you know, last week, effective on Tuesday at noon, the governor made non-essential employees stay home. He basically provided a shelter advisory order. We've adapted our work schedule even further here as much as possible. And we're continuing to do everything we can to encourage people to get the work done that needs to be done at town hall and in this, in the community, in the neighborhood, but as much as possible, protect our people, limit interactions between ourselves and the outside world on a one-to-one personal basis, and just keep it to phone and email as much as possible. Even inside the building, as much as possible, we're using the phone system and email to communicate. I've been working with our partners around the region, Anthony and Saldi, and the rest of us, the legislature. This might actually better fall under a later part of the agenda, but while I'm talking, I'll try and get it out of the way. The legislature is going to be taking up some items to make local government operations a little bit easier. If they didn't do it today, they'll be doing it in the next day or so. One of those items was aimed at helping municipalities with annual town meetings by allowing potentially a relaxing of the quorum requirements for town meetings and making it possible that the boards of selectmen could relax those through a vote of a properly advertised meeting. That was in the governor's recommendation. When the House got it, they struck that line out of the the bill they proposed. We have, as a group of North Shore managers, with the assistance of MAPC, sent a letter to Speaker DeLeo and Senate President Spilka and asked them to return that language to the bill, so that you folks, the small towns like us, will have the benefit of maybe being able to continue to operate in the best ways possible, while also addressing our residents' concerns about, gathering together. As we noted in the letter, people, even once the bans are lifted and people are allowed to go back to work, there will still be some hesitation by some folks to return to large group meetings for a while. This could last into the summer. That makes it even harder to get quorums together. So we're hoping that the letters from our communities will be effective in helping relax that restriction. And I'll let you know as soon as the bill gets passed. I don't know, Tom, I don't think they took it up today, did they? I hadn't heard anything.
Joe, no, I haven't heard anything either, and I'm sure that I would have received an update if it had been voted on.
Okay. I feel like I'm forgetting something else that's come up. We've been working a lot lately trying to address different things. You know that we've had some close calls with some of our public safety responses to things. We've got some good news today. One of the staff members who had potentially been exposed, that exposure got their test back and it was negative. So that individual's returning to work tomorrow, and we're all very glad to see him coming back. There was no, there's no risk. He's been asked to continue to wear a mask and monitor himself for symptoms, but he's cleared to work. So we're gonna work through that for the next couple of days. Chief, am I forgetting anything? Because you've been at my right hand almost every day when we've had stuff coming up. So.
No, public safety wise, it's everyone's doing what they're supposed to do. We have a couple cases in town. PPE, personal protection equipment, that we've got protocols in place. Chief Brunette's got his for his side. I've got mine for my side, for the police side. We're working together. We're trying to limit the exposure. That's really, for us, it's about limiting the exposure. Try to limit the amount of people that are being exposed to this. And, so far it's so good, but we're predicting the numbers going up. And I don't want to be an alarmist, but we are predicting the numbers are going to go up. We have enough PPE for a short period of time, so we're good there. Chris Lee is always bringing the N95 masks over to us. Kudos to Brad Hill. I called him for some gloves today, and he dropped off a case of extra large gloves to the fire department for us. So we're doing it. It's working.
A couple of regular business items, just to let you know. I included these in my town manager report, so I won't go into great detail, but just to let you know, different things that aren't necessary or essential type of services that we continue to make progress on. The LED sign that's been planned and permitted in front of Town Hall, we finally signed the contract with the vendor to do that. That is a one-man job, so you will be able to see that person go ahead and start making the installation here sometime, we hope, in the next month. Tim is just taking the contract back to ZBA just to confirm that everything in the contract meets with the ZBA's expectations. We've also signed a contract with a company to do pavement markings, road striping. Again, that is not something that requires our crew. You typically, when we do this work, one DPW worker follows the vendor in a truck to make sure that they know where all the pavements needs to be marked, and that'll be happening during this period of kind of lower use of the roadway. So I think that'll help. And we got good news. the Board of Selectmen will remember that we had to go through the effort of renewing our hazard mitigation plan, updating our hazard mitigation plan last year so that we would qualify for reimbursement of the Bridge Street culvert. Obviously, we did complete that by December like we were supposed to, and we were informed by MEMA earlier this month that we've been approved for that further reimbursement of about $163,000 back to the town, which is money we already spent. So that'll come back and make us whole for that project. So those are all good news things that are kind of not as critical right now in this time, but it's good to share some good news. And I also appeared virtually at a Board of Directors meeting for the Asbury Grove Board of Directors. We talked through some of the issues that we had with trying to help them with their water supply situation. They're making adjustments as we have asked them to the seasonal usage meter. There were some year-round homes that were on that meter that they're removing them this week. There is the pool that they're going to segregate out onto a separate meter, and then we'll be able to take that seasonal meter and make it truly a seasonal meter, and 6 months out of the year it won't be used. So that'll help them not be kind of penalized for a condition that they can't support. So we made great progress with them on all that, and I think they're happy-ish that we're working with them. We hope to have all that stuff in place for the final quarter billing, which takes place next week. So we're working on it. We keep moving.
That's really good, Joe.
Right.
So can we go back to the town meeting talk for just a second? I know we got Tom on the phone here, and I was just looking at the executive order from the governor and reading it over, and it's saying, and Tom can correct me if I'm wrong, that if the date cannot be later than 30 days after the announcement of the recess, notice must be filed with the town clerk. A public safety official designated by the select board must then send a letter to the attorney general informing her of the recess, and then etc. And it says, if you'd like to postpone for a later time, you should seek passage of a special act or obtain a court order. Will we be looking at doing that, or has any of that changed in the last handful of days since the executive order on the 23rd?
No, I don't think so. I think at this point, the hope is, I think you, as well as most towns, are kind of in the same position, which is a bit of a wait and see approach to see, how this kind of plays out. I think the intent that I think we had talked about some potential dates for a town meeting. I think what we'll likely see happen is, in the event that it's not possible to hold a town meeting prior to June 30th, when the fiscal year ends, then I would expect that there will be a legislative action to address that particular issue. I don't know specifically what that will look like. My best guess would be that it would take a similar format to what's currently in place for cities that don't have a budget in place by the start of a new fiscal year, or regional school districts in the event that they're unable to come to a resolution on a budget. And that would be what's referred to as a 1/12 budget, where they basically, with the approval of the Department of Revenue, you would most likely be allowed to go to a situation where you're allowed to spend essentially 1/12 of your prior year's budget on a monthly basis.
Right.
Until you get a budget in place.
And so, Tom, I'm going to assume that you're going to keep Joe abreast of the kind of the 30-day mark from when we postpone town meeting to keep us in the loop about if we need to file anything. I'm assuming.
Absolutely. Yes. Yeah. Absolutely.
We're phone buddies. We talk every day right now. So,
Joe, in terms of government operations, how have the residents been? Have they been understanding? Are there any complaints that you're hearing, or?
Fortunately, no. It's been pretty quiet. I actually had one woman call last week, right before, it was Monday actually, before the governor's order actually went into effect. It was kind of amusing that a woman called who kind of grilled my assistant Michelle for about 15 minutes, basically wanting to know why we were still here. And we said, well, first of all, the governor's order doesn't go in effect till noon, and it does exempt essential employees, of which we are considered. So, we're not shutting down the whole operation, but we're going to do everything. She was really concerned that we were being safe for ourselves and the public at large, and we assured her that we are indeed doing everything we can to be safe. So, it was nice to get that kind of a call, not a why aren't you open, but a why are you still open call. It was kind of kind of funny, but for the most part, people have been understanding. Explain to them what's going on. They understand the shelter-in-place advisor. They understand. They've understood that we've asked them to put off non-essential work or requests for things like non-essential inspections. Things that aren't emergency issues. We're saying, can you wait till we get through this period? We'd really rather not send our inspectors into your home, and they get that. They understand that. They're working with us on that. So, while we've got them here too, shout out to Anthony and Jackie and Wenham again. Jackie obviously helps work with Patrick to oversee the way our inspectors are utilized here in town, and they've worked very well together to make sure the message was unified and on point as far as it goes with inspections and things. So we're continuing to keep that stuff going. So
good, excellent. All right. Anything else, Joe?
I don't think so. Not right now.
All right, Tom, you're up. Updates from state actions.
So I'm not sure if there's anything really, new at this point that you haven't seen or we haven't discussed yet. So I don't know if you had any specific questions about anything that's currently pending. I think when we last spoke was last week when the governor issued his order. Since that time, there have been some additional issues that have arisen with and additional DPH guidance that has been put out. I think probably the biggest issue that has come up in the last week, particularly towards the end of the week, was following the governor's order on March 23rd. There was a lot of questions that arose with respect to construction services in particular. And on the 25th of March, the governor's chief legal counsel issued a letter trying to clarify some of those issues. You may have seen in the news that City of Boston, I think Cambridge, as well as Somerville, have all basically said that they don't have any intention of rescinding their bans on construction projects because in their opinions they feel that there's no way to practically social distance on a construction site. The governor's position is that construction is a essential function that needs to continue, and there's been some disagreement on that particular issue. In order to try to resolve it, the governor's chief legal counsel issued a letter on the 25th that tries to set forth some guidelines with respect to construction and the conduct that's expected of contractors and tradesmen while they're on the construction site in order to try to socially distance as much as possible, to maintain sanitary facilities for the workers to be able to wash their hands with hot water and Purell and other hand sanitizers and things like that. So that's really kind of been the biggest thing that's come as questions about town meeting and elections, which I think we've covered already.
Great. Does anybody have any questions?
Can I just jump in? And as Tom was talking, I just wanted to say that we did get notified by the state today, by DLS, the Division of Local Services at DOR, that they wanted us to start to prepare to apply to them for potential reimbursements for our COVID-19 response. We had previously already, Marissa, that is, and I had asked the department heads to start to keep track of any expenses that we accrue during our response to this. And so Marissa has even already developed a draft of a letter that we would submit to DLS at some point in the future. We're going to work with Tom to determine if that needs to come from the Board of Selectmen or if it's all right for me to send that. That was unclear from the messaging we got from DLS. If I, acting as the Chief Administrative Officer, could do it, or if it needed to come from the Chief Executive Board. So we have to confirm that. But we've already been working on tracking our expenses associated with this response so that we'll be prepared to apply as soon as possible. And so this is in addition to what Chris Small referenced earlier as far as funding for the health side of things. This will be for all of our expenses associated with our response right now. So that's good
Joe,
news.
it's David. May I interject a point here?
Yep.
It's clear to me that from the weekly conference calls with the commissioner, that our public health nurses in our towns are becoming overwhelmed with all of the work that's required once a positive or positives are identified, and when the contacts with a positive happen to reside in Hamilton, for example. So Chris has got a growing list of names of people. She's got to track and monitor and all that. And I think that's going to become the single most significant incremental increase in labor that the town is going to incur. And I just want to give everybody the heads up that that's coming, and it's a critical function, and we just have to support her in that role. So I think that's going to be a significant one. The state seems so far to be on top of they're sympathetic to our request. You've seen they approved the first, they said they're going to approve the second, and it's going to come in dribs and drabs, but we're going to need every penny of additional money that we can get to do what we've got to do to track and monitor these positive cases and their contacts. So I just want to let you know that.
David, may I ask you a question about the monitoring of the contacts? Are they going to be testing those contacts?
Here's how it works. First, a positive and a contact has to record their temperature daily and report that information to Chris, who records it, and it goes into what is called MAVEN, the state database for these COVID-19 cases. And then the state has set up two categories of individual persons under investigation. They're called PUIs. Yep. There's the positives, and then there's the contacts with the positives. And once someone's been once someone is tested positive, they go into what's called isolation, and specifically an isolation protocol that's set up by CDC, which requires 14 days of monitoring. And at the end of the 14 days, then they have to submit to 2 consecutive day-apart tests, and those tests must be negative for them to go back into the general population. And only then can they be released. Someone who has been in contact with a positive is still a person under investigation, but they're in the quarantine category. You might wonder, what's the difference between quarantine and isolation? It's an important difference. Someone who has tested positive goes into the isolation category and follow-up protocol. Someone who has been in contact with or is suspected but not tested positive goes into the isolation protocol, and they stay in that for 14 days. They don't get tested unless they develop sufficient symptoms to qualify for testing. But if they go through the 14-day period without demonstrating symptoms, then they can be released. So it's a queue, and the queue is constantly changing.
Yes.
And Chris Lee is our focal point for all of that that's going on.
Eyes and ears. Now, when the contact does have symptoms, they're tested, and then they look for all their contacts if they come up positive?
Oh, yes. Then you can see how this propagates.
Oh, yes,
and
I do.
One becomes 2, becomes 8, becomes 16, becomes 32.
Well, that's how they're going to identify hotspots, and when if we can get that kind of information, we'll be able to have plans, we can go forward. So I just wanted to make sure that they were testing the contacts of the positive
if they meet, Darcy, that is true. If they meet the state criteria in one of those 8 categories for the relationship with the positive and the symptoms that they either do or don't display.
Yep. Thank you.
Okay, done.
Any other questions for Tom? All right, we'll move along then. Joe, an update on steps taken by other municipalities.
We talked about them basically a lot in the first part. This agenda was done prior to having David's agenda, and we talked about what other towns that were doing as far as kind of further restricting use of ball fields and tennis courts and the like. So you've done that already tonight. I talked to you a little bit about what our group of municipalities up here in the North Shore has done to try to get some assistance from the legislature. So you kind of have an update on that as well. We're trying to do similar to what our neighbors are doing, but take all the steps that fit for the town of Hamilton versus, bigger towns have more staff. They respond differently than we do, but the goal is the same in all communities. So.
Okay, great. Joe, that's the last item, right?
Yep, that's the last item on the agenda for tonight.
Okay.
Yep.
Good.
Joe, before you go away, can I add one more item?
Sure.
This is ad hoc. Yesterday, you asked me, I volunteered and you asked me to follow up with Crosby's. Now, we all know what an important part in our lives Crosby's plays.
Yep.
So I volunteered to check up on them. I know Al Shepard pretty well, and I visited with Al Shepard this morning. He's the manager of the Crosby store. And I personally inspected what they're doing. Oh, by the way, before I went in the store, I put my face mask on. Hey, Rosie, do you recognize this?
David, it's so crazy. I love it.
So that's my fuzzy.
It's a saddle. It's a girth cover.
Very good. See, my horsey friends know exactly what it is.
I hope you at least washed it.
I did. So I had my mask on, and I inspected a couple things. Number one, they have hand sanitizer at the exit entrance doorways. They have installed lanes in front of the checkout counters with X's, clear X's marked out every 6 feet to spread out the people checking out. They have installed plastic screens that go between the cashier and the customer in the checkout lane. And then I asked Al about, a kind of a quota system, or at least trying to keep the customers from getting too close, from maintaining the 6 foot distance. And Al's response was, look, first of all, I am understaffed right now, and I think you can appreciate every grocery store in the country is understaffed because they're struggling to maintain their stock in order to restock the shelves and respond to the customer inquiries and all that. He said he's instructed all of his staff to try to observe customers who look like they're failing to observe the 6 foot minimum distance and to ask them to spread out more. I guess it's hard to do more than that, but in the couple times I've seen, I've noticed people almost scrupulously trying to avoid getting closer than 6 feet to anybody in the store. So I think he's doing everything that he reasonably can to comply with our health requirements under this COVID-19 pandemic problem. I'm satisfied that and by the way, they have instituted curbside pickup, meaning you now can email your grocery list to them and they'll fill it for you, and you can go park in one of the assigned spots and they'll bring it out to you and put it in your car. So I really think they're doing I commended Al on doing a good job of really trying his best to deal with this unbelievable new reality. So Joe, that's my answer to your question from yesterday.
Yeah, no problem. I actually thought you buried the lead. I thought you were going to start out with the curbside pickup and online ordering. I thought that was when I saw that this morning on Facebook, I thought that was a great change. So that was, I think it's been pretty well received. When I drove by Crosby's earlier, there was hardly any cars in the parking lot. So I think that people are utilizing it. That's good.
Absolutely. I think the town is thrilled with that. So that's all good news.
Can I ask a question, Jeff? How can we keep us in touch with each other? Can we have a meeting every Monday, just because things move so quickly and there's so much going on that has to get done? Do you think?
I think you voted to do that last week.
Yeah, we said it last week.
Okay, I just wanted to double check to make sure that we would have one every Monday at 6.
Correct.
Yeah, you're absolutely right. There's so many things changing so rapidly. Yep.
And so now,
I thought you were going to say every night, but.
Oh. So now may I make a motion?
I think you should.
I make a motion that the Board of Selectmen adjourn for the evening.
Second.
We're going to do a roll call vote, and then David, the Board of Health needs to stay online and do the same thing. Second by Rosie. By roll call vote, Sean Farrell.
Sean Farrell, aye.
William Wilson, aye.
Darcy Dale.
Darcy Dale, aye.
Rosie Kennedy.
Rosie Kennedy, aye.
And Jeff Hubbard.
Jeff Hubbard, aye.
Okay, so the Board of Selectmen's meeting is adjourned. On the Board of Health side. On the Board of Health side, does somebody on your Board of Health want to make that motion, David?
Yes, I will make a motion that the Board of Health adjourn its meeting tonight.
I'll second it. Chris Small.
Okay, by roll call vote, Chris Small,
Chris Small, aye.
Giselle Perez,
Giselle Perez, aye. Eagerly.
and David Smith.
David Smith, aye.
Okay, the Board of Health is now adjourned as well. Folks, thanks very much. I appreciate all your help and all your support. Good meeting tonight.
Thank you, Joe.
Everybody.
Thanks, Jeff.
Thank you.
Thanks, Tom.
Okay, good night, everybody.
Everybody.
Good night, everybody.